Why is sulfur produced in the ear canal? What is a sulfur plug? How can you remove it yourself? In what cases should you go to the doctor? Watch the video to the end to get answers to these questions. Before you start watching the video, we want to remind you that you can subscribe to the channel to always be aware of our new releases. The ears are the organ of hearing. They have a rather complex structure. As part of the inner ear, there is a special apparatus responsible for the balance and orientation of a person in space. The external auditory canal connects the auricle with the middle and inner ear. Why is sulfur produced in the ear canal? Ear wax is synthesized by the cells lining the ear canal to protect the hearing organ. The presence of sulfur allows filter from small dust particles, do not allow water to penetrate, to protect the eardrum, destroy penetrating microorganisms. Normally, sulfur itself is released into the auricle, only you need to remove it with a cotton swab, or simply rinse the auricles. What is a sulfur plug? A sulfur plug is an accumulation and seal on a certain area of the auditory canal of sulfur. An obstacle to the passage of air is formed. The reasons for such an event may be thorough cleansing of the auditory passages with cotton swabs, which tamper sulfur, frequent ingress of water into the ears, recently suffered inflammation of the middle ear, purulent of catarrhal otitis media, a large amount of hair in the ears, advanced age, using headphones that are inserted inside the ear, including telephone headsets, high cholesterol, impaired fat metabolism, hormonal dysfunction leading to changes in the structure of the skin, skin diseases with localization of the process on the head, seborrhea, psoriasis, atmospheric pressure drops, dry dusty air. The reasons leading to the formation of sulfur plugs may be different, but the manifestations are always the same: congestion in one or both ears, hearing loss, the appearance of extraneous noises in the ears and head, dizziness, nausea, headaches, the appearance of your own voice in the ear, discomfort in the heart area, coughing. When such manifestations appear, one may suspect the presence of a sulfur plug in the auditory canal. Of course, to confirm the diagnosis, you should consult a doctor, but you can try to remove it yourself. How can you remove the sulfur plug at home? There are several ways. Removing the plug with plain water. It is necessary to rinse with a syringe without a needle, using warm boiled water. Do not force the jet coming out of the syringe too much. The use of hydrogen peroxide, which is instilled into the ear lining on its side. The appearance of foam indicates a passing reaction. The use of special drops, such as Otipax or Vaxoil. You can wash it using onion juice, which should be diluted with water in a ratio of 1:1, and still 2–3 times a day. With this method, not only the cork will dissolve, but disinfection will also occur. Milk with hemp oil, also one of the folk ways to get rid of sulfur plug. Milk should be warmed up, add 3 drops of oil to it, and use a pipette to instill in the ears. In what cases should you go to the doctor? If you experience unpleasant symptoms associated with hearing loss, stuffy ears, you should definitely visit a doctor. When washing at home does not bring effect, severe pains appear, ichor discharge from the auditory passages, then you should go to the doctor. An examination by an otolaryngologist is required for the development of complications, namely formation of chronic inflammation, constant pain in the head, throbbing, rather intense ear pain, itching and burning in the area of the external auditory canal, dizziness. Such complications can occur both during independent procedures for cleaning the auditory passages and before these events. Therefore, take care of yourself, and before you act, show yourself to the doctor.